What do we got going on here?
Fluid.
No, none of that secretions, you guys. Fluid.
Fluid, sorry.
Pleurofusion.
Decreased compliance. Big problem, fluid and decreased compliance. Way too much fluid. So, ACPC. Pressure control, these patients are gonna need pressure control.
Thank you. Sorry.
Everything, so respiratory rate's gonna be standard. FiO2, 100%. If your patient is CHF and going on the vent, they're gonna need to be at 100%. And higher PEEP, so +10. Or remember if the patient was on BiPAP or CPAP before, if their oxygenation was okay, you would keep them on the same amount. So, or whatever they were on. Yes, and And if you guys want, when you go on the vents today, if you're studying for the final, you can take that little MDI spacer and put it in line so you make sure you see how it goes, so you're familiar with it. What's gonna be our special considerations for this patient? Lasix, yep, Lasix. Lots of it. Watch the I and O's in and out, and urine output. What's normal urine output?
400.
About 40. 40 mLs an hour.
Oh.
I'll just put higher peaks under here because we mentioned it up there. So higher peak levels are fine to help with the fluid management. What else? Do we want to typically go straight to the ventilator for this patient? BiPAP, which actually, I can't believe I didn't put under COPD. For both of these patients, we should always try BiPAP first. Sorry about that. Try BiPAP. If we can keep them off the vent, they'll be that much better off. And does anybody know what other medication the CHF patient needs? No, not steroids. I think we've talked to inotropic agent.
Pulmazine.
Those are digitalis and digoxin, most common ones. What do inotropic agents do? They make the heart contract harder. Like it increases the fancy term for it is it increases the contractility of the heart, but what that means is it makes it beat harder. So it's a stronger contraction to help pump the blood. So that's standard medication for CHF. So asthma patients and COPD patients, they get steroids and breathing treatments and all that. CHF patients get Lasix, high peaks, inotropic agents. And always try BiPAP, CPAP first. A lot of them will be on it at home as well. Yeah, a lot of people they'll just call it DIG.
My mom was on there.
Yeah.
What does it do?
It increases that makes the heart beat harder. Like it increases, pump more blood.
Oh, okay.
So let's say the heart's just pumping like this right now. You give an inotropic agent, it's gonna make it squeeze harder to get more blood pumped out. Because that's the big problem is it's backing up.
All I need that was saying.
Yep,